Good Monday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to our team members working the KCHD Public Information Line and the folks at 311. We are extremely appreciative of the work they are doing to answer questions regarding testing, the response, and the reopening. Thank you for your continued work to serve the public and provide valuable information during these uncertain times. We want to begin with a couple of notes about testing. Today, we continue to offer walk-in testing at the main health department location at 140 Damron Avenue from 9 a.m. to 3 p.m. Additionally, we are working with the East Tennessee Free Medical Clinic and Connect Ministries to offer a testing opportunity in East Knoxville today. It's currently underway at Magnolia Avenue Methodist Church until 2 p.m. For both of today's testing opportunities, you do not need to have an appointment or symptoms, and testing is at no cost to the individual. We'll now move into the local situation. We have 680 confirmed cases of COVID-19 in Knox County. Additionally, we have 26 probable cases. 540 of our cases have recovered, giving us 135 active cases. 58 individuals have been hospitalized at some point in their illness. 4 Knox County residents are currently hospitalized, and we're thankful to report that we have no additional deaths due to complications from COVID-19. We saw a notable increase in cases over the weekend and into today. While we did expect to see an increase in cases as our community reopened, the increase is still concerning. COVID-19 is still very much a part of our community, and because of that, we continue to stress the importance of the 5 core actions. Wear a mask. Once again, your mask protects me and my mask protects you. 2, physically distance. Stay at least 6 feet away from each other. Sanitize surface frequently is number 3. Number 4, wash hands regularly. And number 5, stay at home if you're sick or if you've been told to quarantine or isolate. We know everyone wants to return to what's normal following these 5 core actions, such as wearing a mask, and following these core actions, such as wearing a mask isn't always ideal. But by doing so, you are protecting the people around you, your family, your friends, coworkers, and neighbors. While you may be young and healthy and not scared of getting the virus, there may be someone in your life who is at higher risk of complications. By wearing a mask and physically distancing, you are helping to protect them. I know this is repetitive, but we can't stress it enough. You have the power to make decisions that decrease the burden of disease in our community. And now I'll open it up for questions.
All right, please go ahead and submit your questions in that chat feature. And please remember to type your name in and the organization in which you are affiliated with. First question is from Alan Sims from inside of Knoxville. He's got a couple questions regarding probable cases. His first question is, how does someone get added to this list?
So a probable case is what we call an epi-linked case. And what that means is that they are a contact to a known laboratory confirmed case that has also developed symptoms compatible with COVID-19.
His next question is, are they then tested to determine status?
They can if they want to be, but they don't have to be. So the reason we have this case definition from the state and the federal government is to be able to rapidly treat them just like they're a case. So if you've been exposed to somebody and develop symptoms, we're treating you like a case. We start the investigation with that individual and make sure all their contacts get quarantined as well. So some of them opt to get tested and some of them do not. It's really up to the individual. It doesn't really change the response though.
His next question in regards to probable cases, are these cases moved to the case numbers or dismissed if they are negative?
If they become a case, if they get tested, they do move to the case numbers. Yes. If they're negative, they stay a probable case because again, they've got symptoms and they've been epi-linked, so everything stays the same. They're treated like a case regardless of a negative test.
Next question is, how long do they remain in the category?
They remain in the category just like a case remains in isolation, so through their isolation period. So for probable cases and laboratory confirmed cases, they're in isolation for at least 10 days from the onset of symptoms. And then with the 72 hours fever-free and improvement in respiratory symptoms, all of that stays the same whether you're a case or a probable case. So at least 10 days they're in that count.
All right, and the final question from Alan here regards to probable cases. He wants to know, can we know how many people enter and exit this group? For example, If the number goes up by 2 from one day to the next, we don't know if 10 came off and 12 were added. It makes it appear that the group never gets resolved.
Well, the group's getting resolved in that they're either staying probables the whole time and they roll off appropriately when they in their isolation period, or they become cases and they are included in those numbers. I'll also note that when you do all of our data analysis down below, the probables are documented in there as well. Again, because we treat them like cases. So it's very complicated to show all of that. When I've looked at how, and our FEs look at how that's being reported across the country, it's pretty much just the numbers of probables. But we can take and look at that further if it's confusing at this time. They do move into the, and they also do move into the recovered numbers as well. So,
all right, from Shannon with WBIR. This is the highest amount of active cases Knox County has seen yet. Why, and is this a concern?
So it is concerning. As I said in the statement at the beginning, we are worried about it. We do encourage people to continue to follow the 5 core actions. Honestly, a lot of what we're hearing when we're doing our case investigations is people haven't always been doing that. There's also, again, more activity, and we expect that. But those 5 core actions are very important, which is why we continue to stress them. And people really understanding that there does continue to be a risk here in the community for this, and we want them to take it seriously.
Another question from Shannon with WBIR. She's got a couple questions here about clusters. Her first question is, any new clusters the public should know about?
Not any that the public should know about, but I should say we're always, the way we're doing our testing, and again, because we are talking to cases and contacts all the time, and then contacts get tested, we have a lot of clusters at any one point in time. That's how public health works in this situation. But no new clusters for public notification at this time. All of their contacts are being notified appropriately and put into quarantine appropriately.
Her next question was, what is your criteria for public notification of clusters?
So yeah, like we've explained before, if we cannot reach out to all of the close contacts of the individual case or probable case, if there's not a way to do that, and close contacts again is within 6 feet of somebody for more than 10 minutes, then we would have to make a public notification. In the vast majority of all of our cases, we are able to do that. But if we can't, that's when a public notification would be made.
And her last question in this topic is, how many people / cases do there have to be for it to be considered a cluster?
A cluster is more than, or it's 2 cases or more associated to a single location or event that's not a household.
From Megan with WVLT. Last week, you mentioned that there were 215 complaints against Knox County businesses who were accused of not following COVID-19 guidelines.
Mm-hmm.
Can you speak to the number of those businesses who have been repeat offenders, and what measures can you take to encourage businesses to adhere to the guidelines aside from education?
At this point, I don't have the details of how many of those are repeat offenders. We do continue to educate. After that, there's not a lot we can do unless there are cases associated with the business. And then we can go through all the same things that we do for cases, and if we need to. So, but if not, it's just education at this time.
From Shannon with WBIR. The state hired on an outside company to help with contact tracing. Are any of those people helping in Knox County?
Yeah, that was the thing on Friday that I mentioned, was just starting to move this way. We're starting to move to it. The state has brought on a company to do, it's not contact tracing, it's actually case monitoring and contact monitoring. And we are participating in that. There's not a set number of people associated with us, which is one of the reasons we had to change how we report our benchmarks with the number of people that are working with us. But they're handling, and we're in this week actively moving our case and contact monitoring to them.
From Jeff with WATE, are there any clusters or patterns developing in the recent increase in cases?
I don't have anything at this time. They're all, a lot of them the past 2 days, they're still in investigation stages, and don't know a lot of the specific details the team does, but I haven't heard all of them yet. But I do know we're seeing more young people. Again, people getting out and about and going on trips and having parties and those types of things. So again, that's where we come back to when we started today, talking about the importance of those 5 core measures, because they really are going to do the best that we can to protect ourselves and our community.
From Megan with WVLT, in May, Knox County hit a red light for proceeding with the reopening plan. Can you explain what change that allowed you explain what changed that allowed the benchmark to be, I'm not sure what that word is, but I think reassigned maybe as a green light?
So we talked about that on Friday. The benchmark on Friday for new cases moved to green. And that was based on that 14-day window. We did not have any statistical aberrations or changes in our new case count. The way that we view our data is to be able to see cases. We expect increases, like we said, but we don't want huge spikes, and that's what's worrisome. Over that 2-week window, we had what had been demonstrated in the statistical analysis was it pretty much had leveled off around 15 or so cases. When you looked at that, that's changed a little bit over the weekend. So we'll see what the data looks like moving forward. But for the previous 2 weeks, we were pretty statistically, staying at a flat number for us.
From Shannon with WBIR, the Tennessee Department of Health said Friday they're concerned about ICU capacity come fall/flu season/school starting up based on the current curve. Is that a concern in Knox County?
That's absolutely a concern, which again, I know I'm being repetitive, but while we're going back to all those prevention measures, there's always going to be risks for hospitalizations, and then from there being in critical care. So there's ICU beds and those vent beds. And there's not an infinite number of resources for that. They're very finite. While there's surge capacity built in, there is still an endpoint there, and so we need to stay under that. So that's where we go back to all of those messages. We are watching it very closely. As we mentioned, our hospitalizations have been slowly going up as well, and so we're having talks with our healthcare system partners all the time about it. But it is worrisome.
Also from Shannon with WBIR, Memphis is looking to go back to phase 1. Is Knox County, and does Knox County still have that authority to pull back individually under Tennessee Pledge?
That'll be up to the Board of Health, so that will be meeting July 1st. Thank you. I didn't want to say the wrong date. And that discussion will be had at that time.
From Megan with WBLT, can you explain how and why widespread testing benefits the community, even though it may increase the positive case count?
Yeah, because the whole point of widespread testing is to be able to identify those that have that disease and then quickly get them into isolation so they're not within the community continuing to spread it, and then find out who their contacts are and get them appropriately quarantined. So again, we help to prevent the spread of the infection. It's all about breaking the chain. And that's what public health work's long been about. We've used this method. It's been tried and true for many, many years for a lot of different diseases. But it's the more that we test and when we find cases, that's good. So then we can take appropriate measures to protect the community based on those cases.
From Shannon with WBIR, the state health department is reporting very low vaccination rates for children because of fear to go to the doctor during the pandemic. What is the health department doing to get caught up for vaccines as the school year approaches?
We are actively working on our plans to be able to help with that, and more information will be coming, I'm sure, in the near future on how we will be working our back to school vaccination program to make sure that we do get caught up, because we believe that is very important.
From Jeff with WATE, at this point, how large would an increase in active/overall case count need to be in order to be statistically significant?
I don't have the number right in front of me. You have to look at the chart, but it's based on the 14-day average and then the standard deviation based on that. And it's more than between 1.5 and 3, I think, is yellow, and over 3 standard deviations is red. And that number changes all the time because it's based on the 14-day rolling average. And I just don't have what that number is right now, but we can try to follow up with that if we need to.
From Brian Hornback, according to a news story out of Nashville, Nashville has pulled beer licenses for 4 large event venues in downtown Nashville for not complying with social distance rules. Do you see that occurring here?
At this time, I don't. The guidance that we've received from our legal department and has been that we educate and follow up with that. We don't have that option for us right now here.
Any other questions? Please go ahead and submit them into the chat feature now. All right, not seeing any other questions come in. So thank you all for joining us, and we will be back here for the media briefing on Wednesday at the same time. Hope you guys have a good rest of your day.